Do you have HS? Me too. You don't believe me? Look, see? Yeah.
Hi, HS Warrior. So I was really interested to come across your video. I don't often see a lot of other people sharing about managing hidradenitis suppurativa holistically. And so I want to dive into a little bit of what you were explaining. And so if you're interested, please go back and watch her full video and then come back here, because what I'm going to do is she mentioned three things. One, she referenced The Hidden Plague by Tara Grant. This is a book written by an HS Warrior. Tara Grant was literally like, oh my gosh, 10 years ago doing, self-experimentation on diet and how to manage HS holistically, and was very successful and published a book, which was published by Primal Blueprint Publishing, which is Mark Sisson's, the founder of Primal Kitchen, his publishing house. And it was actually a blog post she did on Rob Wolf's website. So again, very much into the old school, paleo community, which directed me toward the autoimmune protocol, which is really cool. So, and, I don't reference that book often because I do think that there are a lot of things in there which are not actually accurate, but I think that it was still very, Tara Grant pioneered a lot in terms of the self-healing of, chronic illness. Okay, but so moving on. So that's what she's referencing. Essentially, The Hidden Plague outlines an elimination diet. It is like a modified autoimmune paleo program, which, again, is a start for a lot of people with HS. But let's talk about two main things, lymphatic system and candida. So candida is a yeast overgrowth that happens in the body. And one of the biggest drivers of candida overgrowth is overuse of antibiotics. And I thoroughly believe that the reason that a lot of people with HS are really sensitive to yeast and sugar, which they realize that a lot of people with HS are like, oh yeah, yeast and sugar are trigger foods, to the point where the nutritional toolbox for HS, which was written by RDs and doctors, says to remove yeast and sugar from your diet. But I don't think it's that yeast and sugar inherently impact HS. It's that you're right. I think a lot of people with HS have candida overgrowth because due to the overuse of antibiotics, because overuse of antibiotics will lead to candida overgrowth. But that is something that doesn't have to be forever. And treating it with monostat topically, I think is a short-sighted way to manage that. I think there's other ways to, usually what as a nutritionist, what I tell people who have those wounds that won't close, I'll say, omit sugar from your diet, omit dairy, right? Omit yeasty foods, focus on more protein. And then, yeah, definitely, a lot of the antimicrobial and antifungal topical stuff helps as well. But, just, I think putting monostat again, topically, short-sighted because the candida is still in your gut. So talking about how to treat that, and then a candida cleanse, there's a lot of things that go viral on the internet. People are like, do a candida cleanse, do a candida cleanse. It's not something you just do willy-nilly. Start taking a bunch of antifungal supplements, because you can actually make yourself worse. It's definitely something you wanted to work with a practitioner. So either asking your doctor or working with a nutritionist or a functional medicine doctor to do a test and treat it, right, accordingly. But she mentioned the lymphatic system. And this is something that I touch upon often in terms of, in my guides and my courses about why it's important to drink water and work out. And I know people with HS tend to not work out because they're in pain or they feel like sweating makes their HS worse. But I want you guys to understand what role the lymphatic system plays in hidradenitis suppurativa and why it's important to move the lymph. And I've talked a lot about and recommended to people to do lymphatic drainage massages, whether it's a full body one or even just doing it the face and neck kind. So I have some notes on my screen, so I'm going to be reading from that, but I want to read to you again about the lymphatic system. So bear with me. So the lymphatic system and its cells play a significant role in the pathophysiology of hidradenitis suppurativa, which of course is a chronic inflammatory skin condition. Understanding this connection is important when considering the role of immune dysregulation and inflammation in HS. So this is the overview. The lymphatic system includes lymphatic vessels, lymph nodes, and lymphatic cells, such as lymphocytes, which are critical for maintaining immune health and fluid balance. In HS, the lymphatic system can become dysfunctional due to chronic inflammation and tissue damage. And I just want to say, this is why I'm always going back to reducing inflammation, which diet can play a huge role in that, right? Because that's going to be that root cause approach. But I digress. Let's look at key ways in which the lymphatic system plays a role in HS. 1, chronic inflammation and immune dysregulation. Lymphatic cells, which are T cells and B cells, are part of the adaptive immune system, which systems and help regulate the immune response. In HS, there's an overreaction of the immune system leading to excessive inflammation in hair follicles and the surrounding skin. Pro-inflammatory cytokines like TNF-A and IL-1IB produced by immune cells exacerbate this condition, causing the tissue destruction and further activating the lymphatic system, which is interesting because like that's what the Humira is, a TNF blocker, right? And so if you actually look at how the biologics work, they interact with the lymphatic cells, right? Okay, so those are how the lymphatic cells are involved. Then lymphatic vessel dysfunction. Chronic inflammation damages lymphatic vessels, impairing their ability to drain fluid and transport immune cells effectively. Poor drainage can lead to localized swelling and the accumulation of immune cells and inflammatory mediators, which worsen the lesions and the nodules characteristic of HS. Again, inflammation. Lymph node involvement. Lymph nodes in areas commonly affected by HS, underarms, groin, etc., may become swollen or tender due to increased immune activity. The persistent activation of lymph nodes can lead to fibrosis, so scar tissue formation, and reduced immune system efficiency over time. Tissue remodeling and fibrosis. The chronic inflammation in HS leads to fibrosis and scarring, which also affects nearby lymphatic vessels and nodes, further disrupting lymph flow. So the scarring creates a vicious cycle of impaired drainage, increased inflammation, and further tissue damage, which, going back to what the creator was saying, draining the lymphatic system. Essentially, yes, walking, drinking more water, but doing things like dry brushing and lymphatic drainage massage is going to really give you that extra oomph. And someone the other day in my live was saying how dry brushing was a game changer for them. So really cool. So then bacterial involvement and the immune response. So bacterial colonization in HS lesions, right? Which we know that HS is not in and of itself an infection, but of course bacteria can colonize in the open wounds, right? In the lesions. It can trigger lymphatic cells to mount an immune response, amplifying the inflammation. The lymphatic system's inability to clear infections effectively or efficiently can contribute to the development of abscesses in the and the sinus tracts. So again, those sinus tracts are the lymphatic system not being able to clear the infections then can help create the sinus tracts. So implications for HS management. Supporting lymphatic health. Let's say regular movement, walking, yoga, swimming can enhance lymphatic flow and drainage. Dry brushing, a lymphatic drainage massage can help reduce fluid buildup through these, though these should be done carefully to avoid doing irritating lesions. I would Google how, there's so many videos on YouTube, but dry brushing, short dry bristle brush, you're gonna, in this motion, starting at your ankles, work your way up, starting at your arms, work your way up. You're essentially drawing the fluid gently, because when you're working with the lymph, you're not pressing hard. It's literally just moving the fluid that's right under your skin. There's also a creator on here, which I've reposted her video. She does really great tutorials on lymphatic drainage massages. Okay. Reducing inflammation. This is literally my soapbox that I always talk about. Anti-inflammatory diets, rich in antioxidants and omega-3 and low glycemic foods can help calm the inflammation affecting the lymphatic system, which is why I harp on you guys so much on diet, but it plays a huge role. Medications targeting inflammatory pathways such as TNF-A inhibitors may reduce lymphatic system burden as well. This is the biologics, right? And so those, of course, are an option for a lot of people. And I would argue, even if you're doing the diet, even if you're doing the medication, also do the diet, which I always say too. Topical and systemic treatments, right? So antibiotics and retinoids can reduce bacterial load and improve skin health, indirectly supporting the lymphatic system. You can talk to your dermatologist for any topical medication to use. And of course, surgical removal of chronic abscesses may relieve pressure on the lymphatic vessels, which that would be either roofing procedures or a wide excision surgery. So I hope that this helped explain to you how the lymphatic system plays such a huge role in hidradenitis suppurativa. And again, if you were curious about the candida, and I can do another video, of course, explaining candida in more detail, but again, really surprised to hear that creator's content, and I can't wait to further connect, because I feel like we have a lot to talk about. But if you want to learn more about managing hidradenitis suppurativa holistically from HS warrior and nutritionist, hit the follow button and feel free to leave me any comments in the comment section.